Today's show, episode of Bedhead Cast is, the title is Psychodermatology, and I'm here with my good friend, Dr. Kirk Barber. And Dr. Barber is the editor-in-chief of the Journal of Cutaneous Medicine and Surgery. Impressive. Anyway, and he also has his own podcast, and that is where he interviews experts in the field twice monthly. And also, I should say, Dr. Barber was awarded the University of Calgary Faculty of Medicine Dr. Tom Anta Award for Clinical Excellence. I think the important thing is, it's great to have Kirk here. He's a mentor of mine, and really, we're setting up this new psychodermatology clinic, but mostly to hear his thoughts about the connection between psychiatry and dermatology and also sleep. So Kirk, we usually start with the word of the day, and the word today that I would pick is skinny.
Okay.
And
let's play with it.
Yeah, okay. So I sort of, they'll use this metaphor as getting the skinny on a topic. And a lot of people want to be thinner than they currently are. Tell me about your thing with skin.
Well, time to give you the skinny on skin. I want to focus on this psychodermatology thing, okay? Because I think that's the critical piece that's being left out. You see all kinds of discussion about what cream you should wear, how you should carry your skin, acne, and other diseases of the skin, but people don't talk about the brain and the skin so much. And I think that's really where we're trying to set up a clinic, and where we're going to try and make a difference. So there's people who have skin disease who are affected by it, right? So they have some kind of mental health, not disease, but instability or condition or whatever psychiatrists call it.
Sure.
And then there are people that have a mental illness that also shows up on their skin. So there's two distinct groups of people like that. And that's where you and I are going to try and sort out over time the difference, so that you can treat one way with medication, the other way you get the skin better, and they need just some chit chat or group therapy, that sort of thing.
Yep, yeah. And like one of the things that, like, over the years, you've referred patients to me, patients that have a skin condition, and the fallout from that. And I've always thought about how the word ectoderm, only nervous tissue and skin tissue comes from that. And I've always thought that patients that have a skin problem, they're often very anxious about it, just like when I had a pimple at the school dance, and I sort of thought, should I go or not? And then also in psychiatry, there's also a degree of shame, of sort of like having to pull back because you're really not at your best. So the patients that you've referred me over time, I've often thought that ectoderm only produces nervous and skin tissue.
Well, remember that ectoderm, for those that aren't medically versed, is part of the embryology. So ectoderm is the piece of the beginning that makes skin and nerve. So we've been connected for a very long time.
Yeah, I definitely, and I think it's because our patients are distinct from other patients in other specialties. They'd have a greater degree of shame, for want of a better, maybe shame is going a bit far for the dermatological conditions, but I remember if I had a new pimple, I'd be afraid to for the high school dance, and not that was the plan, anyways. And also with mental health, people feel very vulnerable and stigmatized. Are they going to be a good, have enough value? And so they'll pull back also. So you've got people with skin conditions pulling back, and people with mental health conditions pulling back. And in many ways, they're related to each other because you're anxious about the other. Anyway, what your
Look,
thoughts?
Remember, skin is what faces the world. Okay,
Right.
so I take your shame, sure. Anxiety might be a better word.
Yes.
They become very anxious about their skin, how they look, their appearance. And these are people that have the skin disease that then develop these mental health issues around it. And I don't want to call them mental health issues because we all experience them.
Right.
Like you mentioned with the pimple, right?
Yes.
I mean, the idea is we all experience that sort of, am I looking my best? Am I putting my best foot forward? Going for a job interview, going on your first, second, third, 12th date, whatever. And so the idea is skin is so important. Then it ties into your mental health so intricately that I think that should be a part of every interview for every dermatologist. And one of the guys who was the leader in the field back in the late 1800s would always say, you have to ask somebody about what their job is. Every single patient should be asked about their job because that's their interaction with the world. And certainly at that time it was the most of it. But now I ask about job in school and how can I make, one of the best questions I use is, what are you not doing because of your skin? And that's our goal. I say at the end, listen, we're going to get you in the swimming pool. That's our goal.
I guess I'm feeling a bit of inadequacy right now, knowing that my colleague, who's an expert in dermatology, appears to be a better psychiatrist than me. But maybe I'm being harsh. We should carry on.
Mine is a very superficial skin look at the human being,
Yeah.
I'm afraid. And so I see what's obvious.
Okay.
I don't see what's under the ectoderm,
Okay.
right, which is the nerves, right, in
Yeah,
the brain. So
you're too kind, and it is also, it's the reason that we set up this clinic. So when you think about, one of the things that you mentioned to me is shingles, and tell me your thoughts about shingles and this.
Well, shingles is just a way to illustrate nerve and skin connection. There's not a lot of mental health involved around shingles other than pain
Yes.
for some folks. And so the idea is it's a nerve infection that shows up on the skin. So it shows that intimate connection between the physical nerve and the skin, and that's the shingles. So the virus lives in the nerve and then tracks out to the skin and then causes the blistering and the pain, because pain is what you get from nerve inflammation, and blisters are what you get from this type of skin inflammation. And so that intimate contact between the two physically. Now, you extrapolate from that, how do you get the nerve and the skin connected through mental health? They're not direct routes. That's the brain. That's
Right.
your place.
Yes, yeah, exactly. So Kirk, listening to what you're saying, I mean, it makes me feel that this idea of producing a psychodermatology clinic, which is what we're in the midst of doing, is going to tie the two conditions closely together. And there's so much work that's been done in this area. You know more about that than I do in terms of what's taking place in Alberta or locally.
Well, even nationally, internationally, there's a recognition now. There's a kind of an awakening. There's been a lot of people doing the work, but it hasn't been, they've been lone voices, right? We've spent a lot of time on the science. Now there's a group of people returning to look at how the brain and skin interact and recognize that interface and how shame, anxiety, those sorts of things make people pick at their skin, make people believe that there are insects coming out of their skin, believe all these odd things
Right.
that would have been in the past dismissed as, here, get out of my office. I don't want to talk about that, because I, as a practitioner, am not skilled enough or prepared enough to talk. And if you say, well, just hang on a second, I'm going to refer you to the psychodermatology clinic. Well, you know how many people are going to go to that?
Well,
So
you know,
we got to kind of change the name.
yeah, no, exactly. Yeah, I mean, I've had one friend of mine say, if you can't put in front of the dermatology side psycho, and tradition is, that tradition's important, but I guess what I would say is that but you can't find normal anywhere, okay? And we're all on a spectrum of psycho, but the good news is that everybody that I've seen over the years, including at your clinic, they're the patients seem happy to be there because they have optimism for closure, that they're going to be able to work and engage with others.
But recognize that they have this other
Yes.
piece to their problem, right? Whereas we've always ignored it, including the patient and the practitioner, because the practitioners, we don't have the skill set and we don't address it usually. So they get sort of left behind.
Right. So Kirk, I was wondering if you'd mind commenting on what you believe the outcome is going to be of this clinic.
Well, the ultimate outcome is going to be better care, right? I mean, it's going to be better care. And not just better care, but taking someone and giving them insight into the problem they have. So lots of skin diseases are chronic. I mean, skin disease is traditionally chronic, except for some of the infections. But helping people live with it, helping people understand it, helping people get away from the anxiety of having it, the depression associated with it, and the shame. I mean, we come back to that business of how this is a deep-rooted kind of how you present yourself to the world. And you might need some help sorting that out. And group therapy. We run eczema camps, well, not eczema camps, we run camps for children with eczema and other significant skin diseases to help them understand. So at the summer camp, they get together with another group of, not another group, but other children with the same problem, so they can chit-chat. So the group therapy thing is, I think, where we're going to end up going. Because one-on-one, we can't tackle all the problems.
And also the research, I guess, that you're involved in with your.
There's a lot of research going on now. Okay, and then to get back to your topic of sleep, we've now when we look at take eczema for example, a number of the scoring systems we use in our research programs are not only looking at the efficacy of the drug, but they're looking at whether people are sleeping and what their mood is. And so we're actually asking the questions now that 5 to 10 years ago, we weren't so interested in. And now it's become part of a critical part of this patient-centric research that we're all embarking on. And the watchword of the day, or the decade, is going to be patient-reported outcomes. And so they're going to be the big deal. And it isn't going to be whether you get your skin 65 versus 55% better. It's going to be your patient-reported outcome. Did you sleep? Were you able to go out? Did you stop doing stuff because of your skin? That sort of questioning.
It's interesting because I'm involved in a group on the community research for bipolar disorder. It's called CREST BD. But all of the patients participate in designing the protocol. They have a question that needs to be answered. Yes. And I'll tell you, over the years, I've often thought my patients have better questions than are necessarily what I'm reading about somebody else being interested in. But they do the protocols, and they are very focused on the outcomes and very involved, as is true. All of our patients participate in their recovery.
Excuse me. There's a new enlightened group in Canada called Skin Canada. And they're a group of dermatologists, researchers, very sophisticated researchers, who are now involving potential research subjects in the development of questions that are answered and trying to direct the research to questions that are actually important to the people who have the condition.
Absolutely. Yeah. So it's a really, I mean, it's a giant step forward in just on a personal note, I've always wanted to be able to work with you, and 40 years later, we're working together, which is something that for me is I know it's more of a burden for you, but for me it's a big deal.
That's why they call it practice.
That's what that practice. Anyways, Kirk, the other day you were talking about again that we're doing a podcast called Bedhead Cast, and it's the bed has to be included at some point, and you had mentioned how sort of this interesting thing about how dermatology has a key relationship with sleep.
Yeah, well, can you imagine burlap sheets in your bed?
No.
That is one of the symbols that the Eczema Society of Canada is promoting, in burlap dresses, burlap clothing, to try and get a sense to others of how troubling itch can be for people. And itch is a terrible thing to have, and it's consistent, and it bothers your sleep.
Right.
And the less sleep you have, the more anxious you become, and then I'll put that into your world. But the idea is that skin condition produces the itching, and it's difficult for people to live with.
It's such an interesting idea. The idea of the burlap sheets, but then when I think about the burlap dress, and that would be something that you could wear out, but nobody who had to wear a burlap dress, even if it was fashionable, would leave the home because it's just too much. And also maybe the burlap dress would be a different, to some extent, fiber, still burlap, but it's at least you're not distracted, you're not busy, you're not doing it,
Yes.
You can do stuff. You get into bed, that's when those burlap sheets are such a big deal. And like you say, if you don't sleep.
Yeah, and the broader point is that people adjust their clothing and how they dress to their skin disease.
Exactly.
And so you have to recognize that too. And for atopics or people that have bad eczema, wool is their burlap, because wool is something that causes them tremendous itch, and it's one of the defining hallmarks of the condition is that they itch when they wear wool, so they modify their clothing. And so it's very, very much a matter of getting back to this patient-reported outcomes. One of the biggest ones we see is sleep.
Yeah.
And if we can correct sleep, and I tell parents of children with eczema, if we can get sleep, that's when we know we're winning.
Right.
When we're making a difference is when they can sleep.
Wow. I'm speechless, which is not common. So the homework for the day is not everybody's got a friend who's a dermatologist, but if you have a problem with your skin, and I guess you're probably not going to hesitate, but it's important for that to be addressed and to acknowledge that your mental health is going to play a role to some extent, and that's going to be respected by the people that are caring for you.
My homework is be open with your practitioner, your family doctor, the dermatologist you're seeing, the general surgeon, whomever you're seeing, because that's the only way you can get help. And we recognize that help, it comes in many forms, and insight is required to gain help. So I always end all my podcasts with one thing. I'm going to end it here today, and all I say is be good to each other.
So I'm gonna close the show, the episode today, and we're looking for sponsorship. You can contact us through bedheadcast@gmail.com and get your head to bed.